Hello, welcome everybody as you pop in from the waiting room, and thanks for joining us today. Give folks a couple seconds to get in here.
Good afternoon, Senator Blumenthal's office. How may I help you?
I'll ask our presenters to mute their mics while we're not on for the moment. Thank you. All right, we have a critical mass of folks in, so I'll introduce myself. I'm Matt Shepard. I'll be moderating today's webinar on how and when to seek help from your congresspersons. It's a presentation of the Community Outreach and Education Project hosted by the Center for Medicare Advocacy, and we are grateful to all of our COPE partners, who you can see on this slide, including the offices from which we got today's presenters. CMA, for those who don't know, is a national nonprofit law organization that works to advance access to comprehensive Medicare coverage, health equity, and quality health care for older people and people with disabilities by providing exceptional legal analysis, education, and advocacy. And you can see some more details on slide 3. Today, we're going to have CMA founder and senior advisor Judy Stein introduce our guests from various Connecticut congressional offices, including Joshua Davenport, Karen Wezeliza, Kylie Dosty, Lisa Perrone, Marilyn Concepcion, we hope, and Rebecca Sanger. But first, please bear with me while I do a little technical housekeeping. I hope everyone's pretty familiar with Zoom by now, but in case you're not, we have a chat feature. You can see Jeff just threw a little welcome out in the chat. Oh, hi, Marilyn. Glad you could make it. To greet everybody, we'd love it if you let us know who you are and where you're listening from, any organization you might be affiliated with. For questions, if you want to write in questions, please try to use the dedicated questions tab down at the bottom of the screen. Hit Q&A, it opens up a panel. You can write stuff in there and I can relay it on to our speakers. Or, of course, when we get to Q&A, you can also ask questions live by using the raise hand icon there at the bottom of your screen. Today, we'd love to tackle as many general kind of questions as we can, but please save case-specific questions for a follow-up call with the appropriate office. We probably wouldn't have time to dig into those in a proper manner today. For those who need it, note that Zoom has a closed caption feature down at the bottom of the screen. Just hit CC and captions will pop up live. I want to thank everyone again for attending, and of course to our presenters for their patience with us today. And I'll now pull up founder and senior advisor, Judy Stein, to get us going. Old habits die hard, Judy.
Yes, for me too. Thank you so much. And it's a pleasure to be with you all on this beautiful day. I want to thank our congressional delegation and their representatives who are speaking today. We really are so fortunate in Connecticut to have such smart and engaged representatives in the House and Senate. The agenda for today is going to allow you to hear from the constituent service, from some constituent service staff, from 5 of our 6 members of the Connecticut delegation. Unfortunately, Representative Hayes' staff was not available today. In order, you can see here, we're going to hear from alphabetically by member's name, which apologies to Kylie. That means that Senator Murphy's office is last, but definitely not least. So we'll hear from Josh Davenport from Senator Richard Blumenthal's office, Karen Wezeliza from Representative Joe Courtney's office, Marilyn Concepcion from Representative Rosa DeLauro's office, Rebecca Sanger from Representative Jim Himes' office, Lisa Perrone from Representative John Larson's office, and Kylie Dosty from Senator Chris Murphy's office. And then we will have, we hope very much, time for general questions. And I'm emphasizing general here because it's really not fair to ask things specifically about your family members or yourself at this time. Just the general problems or questions of how to, protocol of how to seek help. And then you'll be able to contact the offices individually for your individual concerns. Next slide, please. In advance of holding this webinar today, we've asked the panel to all try to address in general and in their own way, in the style of their member's office, the basically these 7 questions. How do you see your role, which may differ from office to office? What do you do in your constituent service position? How can constituents best reach you and your office's other constituent service staff? What can constituents reasonably expect from you and from your office? And what should constituents understand about the limits of the services you can provide? I think 4 and 5, well, all these questions are important, but there are realistic bounds on what constituent staff can make happen. And I'm encouraging the panelists to understand that we understand that these are complicated times right now, and who to contact when, even for them, may be different than it has been. So we'll ask them to address these questions as they have found their work to be in the last number of years, and if they have any tips for how to do things, if necessary, differently now. How, if at all, do you relate between offices and among House and Senate colleagues? I think that's of great interest to members of citizenry, how the House and Senate work together and how members of the House and members of the Senate themselves work together, if at all, to handle constituent concerns, questions, and the issues that you hear from the constituents around the state. If you have any practical tips or other information you want to share, for example, any documents that people should have with them or information they should have with them in order to help you give them help from either an email or a phone call, and we'll ask you the best way to reach you. Next slide, please. These are the 5 congressional districts. Of course, Senator Blumenthal and Senator Murphy represent the entire states. But as you can see here, in orange, we have working from the right to the left. Why? Because I'm in Joe Courtney's district, and so that makes me look at the right-hand side of this map. Also, you see that Representative Courtney, this is District 2, has the largest geographic area in the state. I will ask Karen to tell us whether that's the largest population. I doubt it. Moving to the left, in green is Representative John Larson's district. That's District 1. To his left is Representative Johanna Hayes, who we won't be hearing from her office today, unfortunately. Below that in the pinkish is Representative Jim Himes' district, District 4. And to that right, the right of that in purple is Representative Rosa DeLauro's office, district, which is District 3. So for people listening, hope that orients you to where your district is within the state. And again, a reminder that Senator Blumenthal and Senator Murphy represent the entire state. We thank them all for the work they do. And now I'd like to ask Joshua Davenport from Senator Blumenthal's office, Senator Blumenthal's office, to open his screen and give his presentation, please.
Good afternoon, and thank you, Judy, and thank you, Jeff, for having me, and thank you for putting this all together, and thank you to everyone that is participating. I'm very happy to be here. Just a little bit of background. I've been with the office almost 10 years now. Started off as a staff assistant, and I've been doing constituent services casework for over 5 years now. I've seen a lot, and I just am thankful to be here, and hopefully give our constituents sort of a better idea of what we can do to help and how we can do that. So as far as my role here as a constituent liaison, specifically within the Medicare and healthcare field, I view my role most importantly as one of support. Support for folks who may be frustrated with the systems in place, folks who are seeking guidance, might feel they have nowhere else to turn. I understand a lot of these systems, and a lot of insurance companies, what have you, can be complicated, and many of these issues are perhaps of no doing of your own. And that's sort of where we come in, and we try to act as a liaison to kind of help you through a lot of that tangled mess of that web, so to speak. Now, in my role as a liaison, I basically I help shepherd your inquiries along to various government agencies, insurance companies, etc. I act as an advocate for you, the constituent, and in every case, my goal is to at least provide a formal response from said agency or company that we're dealing with, based on the issue at hand. It's of course it's not possible to provide what's considered quote unquote a positive resolution, perhaps every time. But I try to provide some closure, some more context, some further information, and at least some further guidance and information. Now, as far as reaching me here at the office, the best ways I would say are via phone and email. Blumenthal.senate.gov has all our contact info on there. You could certainly stop by. But we do have a great group of interns currently to answer the phones and help direct your issues, your calls, and relay messages, etc. We also do have a staff assistant to help shepherd along all your inquiries and questions. So I would say, feel free to give us a call, send us an email, and we'll get that passed along to the appropriate caseworker or the appropriate staffer, or at the very least, try to recommend what agency or what avenue you can go down to help alleviate your particular issue or answer your questions. Now, as far as what you could expect working with me or our office here, as far as casework is concerned, in my role here, I do have various congressional contacts within Medicare and all the big insurance companies, etc. Working with you, I'll try to be honest with you. Yet I'm hopeful with each case I have to get things figured out. But I in my role here as a liaison for Senator Blumenthal, I don't have the ability. Our office does not have the ability to overstep any laws that are currently on the books or any company policies, but we can certainly get eyes on things, and get things directed to appropriate contacts that can provide better information or a review of a said issue or whatever is going on. And basically, I try to act as a support, sort of a middleman, to try to take some of that red tape out of the way between the constituent and the agency or company, what have you, and try to get a better flow of information and try to get eyes on the problem that may not have been on that particular issue otherwise. And I will say, in the age of technology here, I think relationships between congressional offices and House and Senate staff, in particular, have increased. I think I could say we've utilized Microsoft Teams chat actually as a way to share resources and ask questions and kind of help each other from within the state and even around the nation within other congressional offices to kind of use as a sounding board. So that's been great. And I think it's really helped, at least on my end. We need a contact or sort of need to just chime in and ask for some support from our colleagues. And I would just say to close, when you're working with our office, I would say a big help for you, the constituent, would be to be as thorough as you can be when describing your issue. More information about what's going on is always better. It allows us to better help you. And as far as our information release form is concerned, that's a form you'd have to fill out that would allow our office and myself to be able to interact on your behalf. I want to make sure folks know to please hand sign that waiver. Otherwise, agencies, etc., generally will not accept, let's say, a digital signature. So with that said, I thank you again, and I appreciate being here.
Thank you very much, Josh. Now we'll say goodbye to Josh till questions, and we'll welcome Karen Weslisa from Representative Joe Courtney's office. Hi, Karen.
Hi, everyone. Good afternoon. So my name is Karen, and as the slide shows, I work in the district office of Congressman Joe Courtney. And I see my role as being an extension of the congressman. He can't be in DC doing that work and in the district doing this work. So all of us that work in the district offices are here to represent him, to support him, and to help with those cases that are in the district. We are the troops on the ground helping do that work. In my particular position, I handle just Social Security, Medicare, any kind of health care, but I also have a queue of early childhood education and animal welfare. So in addition to all of this, I do those cases as well. Which they're not so unrelated. There's a lot of overlap in all of the work that we do. Constituents can best reach our office by calling any of the district offices or DC, and they will always connect you. If it's a healthcare related issue, they will always connect you back to the Enfield district office, which is where I am. So they'll give you a phone number or an email, and either way of reaching me is effective. And I do my best to respond to any correspondence from constituents or agencies, within, 24 hours, depending on, whether it's a Friday or a weekend coming or whatever. And they can reasonably expect that I'm going to ask a lot of questions. I'm going to ask for any information that you might have that's going to help me resolve your case. Did you get any letters from Social Security or Medicare? Do you have any documentation from the insurance company that might explain their denial or their refusal of coverage or their limits on what they're going to cover? I'm going to ask to see all that just so I can put a timeline together and formulate a case. Like, I want to be able to have as much information as I can so that I can represent you the best I can to those agencies. And you can reasonably expect that I'm going to do it. I'm going to do it as quickly as I can, but sometimes it's not immediate. Like, I can't lie. We get a lot of cases, and they're not, some of them just can't be resolved within a day or 5 days. Some of them are going to take a little time. And I try to set reasonable expectations for those cases, and I try to set reasonable expectations if I believe that I may not be able to resolve this favorably. That doesn't mean I'm not going to try, and it doesn't mean I'm not going to use all the resources I have, but I do want to be honest and upfront in the limits of what we can do. And so the limits are that I can't ask for someone to expedite your case. I can't ask for someone to give it a favorable or unfavorable decision based on, you know, what you have provided me. All I can ask them to do is to give it a fair and reasonable consideration. I want to make sure that they're giving it the best. And I want to make sure you're getting the best review that you can, and that's what I'm going to help you do. I can't change a decision. I can argue a decision, and if I think it's wrong, I will go back and push on them a little bit, but I can't always change the decision. So I need to be like upfront with people about that. And to expedite a case, I will ask for a case to be expedited when you're food or housing insecure. If you have no access to food, or you're going to lose your apartment to an eviction, or your house to a foreclosure, then I can ask for them to sort of prioritize that case. But I can't ask them to expedite it. And I know that's really hard for some constituents to hear when you're in that situation. And I do always note that if they're in that situation, I will note that so that people know, and I will follow up more frequently in those cases, because I don't want to see anybody without food or housing. That's not okay with me. The 6 and 7 are kind of interesting questions. How, if at all, do you relate between offices? So between us, we all work with the same agencies and we all work with the same contacts at Social Security. We all work with the same contacts at Medicare. So if you're going to call the congressman's office, you don't have to call the senator's office too. Like, we all have the same contacts. So calling both offices kind of just doubles the workload on the agencies that we use. And it can sort of delay their ability to respond. So if I get a case and someone says to me, you know, I've reached out to one of the senators, I'm going to call them and I'm going to say, like, do you want, you know, where are you on this? Do you want to take it? If you haven't started it yet, I'm happy, but we're going to make sure that you get one solid representative, but any more than that just delays the process for us. So if you have contacted another congressional office or a senator's office, it's helpful if you let us know, because then we can collaborate, and sometimes we can even talk about the case, and you know, we might have suggestions for one or the other that are more helpful. And I would encourage you always to get the time, get back the privacy release. We're all going to ask for that, because some agencies will not talk to us unless they know that we have your written permission to do so. So especially if we're asking for information related to Social Security and Medicare, where that's private information. I mean, your Social Security number, your health information, that is all private information. For them to share anything with us, they're going to want to know that you have given us permission to ask the questions and to have the information. So we do ask that you get that back as promptly as possible. Because in some cases, like if I have your information, you know, I will start putting together a case before I have that release. And so the sooner you get it back to me, the sooner I can make the formal inquiry to Social Security or Medicare or to an insurance company. And those are the only tips that I have. And I hope that when anyone would call the office, they would get someone who was, you know, courteous and kind and understanding. And that is all important to me. And it's important to the congressman as well. So I look forward to taking any calls that you might have and talking with anyone who needs assistance. And I hope you all have a great rest of your day. Bye.
Thanks so much, Karen. Bye-bye. We'll see you a little later, I hope. Now we'll pull up Marilyn Concepcion from Representative Rosa DeLauro's office. Hi, Marilyn.
Hello, and thank you for having me, and thank you for putting this together. I've been with Congresswoman Rosa DeLauro for 23 years, And my main areas have been constituent services is Medicare, Social Security, immigration, passports. I also do a lot of the Hispanic outreach as well as all the IT within the office. So wearing many hats. In terms of the questions, how do I see my role? So we're the staff and the caseworkers are a bridge between the federal agencies and the people of the 3rd Congressional District. We try to assist our constituents, and it varies from immigration all the way to Social Security, as well as sometimes people just have questions, so we try to answer them, or if they have any questions about which forms they need to fill out, or any programs that are available that may be new, and they have questions on that as well. In terms of question number 2, what do you do in your constituent service position? So we try to gather a lot of information in terms of what the specific issue is. If it's if it's a specific issue related to a person, if it's personal, then we'll handle that obviously privately. If it's something that deals with statewide, or if it's more specific to other districts and it involves a bigger group of people, then we'll collaborate and try to, get other agencies and other congressional members to join us and try to find a solution. Number 4, how can constituents best reach us? Obviously, the phone number, we always have somebody live picking up the phones. So it's best to call. And you can also try us online as well. We have all the forms and all the information on our website. We also have walk-ins, so you're more than welcome to stop by our office, and someone will, do an initial intake and take all the information that we need. What can constituents reasonably expect from us? Basically, we can't guarantee a specific outcome, but we will advocate for our constituents, and we will try to keep them informed of the process. Obviously, each case is different, and each case will take a certain amount of time. Some can get resolved quickly, others take a lot longer depending on what the issue is. Like I know with immigration, sometimes I have cases that will last a year. So it depends. What should constituents understand about the limits of our services? We cannot ask a federal agency to, act a certain way or override a legal decision. We cannot ask for favorable outcomes, even though a lot of people think that we can. We also can't offer legal advice in our office because we're not attorneys. And we cannot intervene in judicial matters. Our role is to advocate, facilitate communication between the federal agencies and the constituent, and help the constituents understand the process and how to navigate it. We also do not handle state or local issues, but we do refer, if someone's having an issue with the school, we can refer them to their state senator or state representative or local agencies as well. How, if at all, do you relate between offices among the House and the Senate? I think some folks have touched on this, but when necessary, we'll collaborate together if it involves a bigger group of people outside of our district and within other districts. Obviously, the senators would also get involved. And we also try to coordinate efforts. But mostly we do handle, as Karen said, we have all the same contacts. So it's best if you contract the Congresswoman, then we're gonna, help you as the similar way that any other office would. In terms of any tips that I may have, so For Medicare cases or any case that's very complicated, details in writing are very helpful. If you have a history of everything that you've done, that's also helpful. Completing the privacy release form, we would need that. We wouldn't get any information without it. And it's also important to understand that it may take the agency to 14 to 30 business days to provide us with an initial response to our inquiry. So it doesn't happen fast, but we try to assist as best as we can. And we're always respectful, everything's private, and we try to empathize with what the people are going through. And with that, I just want to thank everyone, and if you have any questions, I'll try to answer as best I can. Thank you.
All right, thank you very much, Marilyn. And now we'll ask Rebecca Sanger from Representative Jim Himes to join us. Hi, Rebecca.
Hi, everyone. I apologize for the darkness on my video feed. But yes, my name is Rebecca Sanger, and I handle a lot of the Medicare inquiries that we receive here in the 4th District, Congressman Himes' office. I've been with the Congressman for about 6 years. I would say that I view our role as assisting constituents in navigating the federal bureaucracy. It can be quite intimidating. And so our office is here to assist constituents in any way that we can, and in this case, specifically with Medicare. So in this position, as I said, we're a liaison between the constituent and the federal agencies. And so the first step is really, when an inquiry comes in, to determine which federal agency is appropriate to reach out to. And if it is not a federal issue, we can direct the constituent to the appropriate state office. For Medicare inquiries specifically, constituents should know, and they may know already, that enrollment and payments are handled by Social Security, whereas inquiries related to claims and coverage issues for specific procedures, devices, or medications would be handled by CMS. And I would say that the vast majority of our Medicare casework relates to enrollment and payments. And so we speak more frequently with Social Security about Medicare issues. The best way for constituents to reach out to us is by phone. Also, our website, as with the other offices, we have our intake paperwork online, but you should feel free to give us a call, and my email address is also posted. What can constituents reasonably expect? As the others have said, we'll do everything that we can to help you resolve your issue. If there's an error, we can bring it to a manager's attention to help get the error corrected faster. Oftentimes it's just a matter of communication, and as others have said, getting eyes on an issue. But I would ask constituents to be mindful that Social Security and CMS are managing benefits for about 100 million people. So sometimes there are mistakes and sometimes things aren't processed properly, but generally we can help fix that. The limits of the services that we can provide, again, as others have noted, ultimately, these are independent agencies, and we don't have the authority to overturn determinations that Social Security and CMS make. We cannot change the rules or federal regulations or, demand that exceptions be made in certain circumstances. And of course, we can't change decisions that are made on the merits. If a constituent receives a determination that they're unhappy with, I would recommend that they always, file an appeal within whatever time is delineated in their letter, and not only reach out to our office, but also preserve their appeal rights by following that procedure. And then, once their appeal is filed, we can certainly flag that for the agency. And relating to other House and Senate offices, again, as others have noted, we will discuss casework when necessary, but the agencies have told us that they do not like to receive duplicative inquiries from more than one congressional office. I know sometimes constituents think that if they contact their representative and both Senate offices, they'll have 3 times as much attention on their case. But it doesn't work that way, and one inquiry is sufficient. Practical tips or information that I would share. I would encourage everyone to pay very close attention to the enrollment requirements for Medicare. And once they're enrolled, to please make sure that premium payments are made on a timely basis. That is something that happens with some frequency, where someone is removed from the Medicare enrollment rolls for overlooking a few payments, and it does take more time to re-enroll than many people anticipate. And then, echoing what other people have said, when you're filling out your forms, make copies, save correspondence that you receive from Medicare and Social Security. And again, with the privacy waiver that we either email to you or on our website, please make sure it is signed by hand. Thank you.
Thank you very much, Rebecca. Really appreciate it. And now we'll hear from Lisa Perone from Representative John Larson's office. Welcome,
Hi.
Lisa.
Hi, good afternoon. Thank you so much, and very happy to be here, and I really appreciate you putting this together for clarification, for people to know how they can interact with us. We are public servants, first and foremost. I've been one for 26 years, and I'm very proud of what I do. I'm the Director of Constituent Services. So when you say, how do I see my role? I see my role as making sure the public is treated with respect and consideration and is listened to, especially in these very difficult times. Sometimes people just want to talk. But in terms of, an information station, educating the public about processes and different agencies, because I do specialize in Medicare and Social Security. However, I work on insurance, I work on labor, I work on, you name it. We're creative problem solvers here. So we try to do everything we can to the best of our ability. And I encourage staff to come with me with questions because nothing's cut and dry in this business. What do I do in my constituent service position? Answer the phones, do the emails, ditto for reaching out to the agencies, as my counterparts have talked about. And we also talk with the congressman about, what's happening right now here on the ground and in the district office, and what kinds of calls and traffic that we get coming through. I'll give you, for example, right now, there's quite a bit of Social Security traffic, because that's what happens when you cut staff and you're not available to the public. But again, happy to do it because we're helping folks. In terms of best reach our office, I have to agree with the phone call, because we log everything. I'm sure the other offices have their own ways of doing things, but we have a massive database and it all goes into the database. DC to me is more policy oriented. So if you have a comment on legislation or an opinion, they're a little, and the opinions will take them as well. Please don't get me wrong. But legislative, policy, you're going to want to talk to DC. And then here in the district, again, there's email, fax, snail mail, but the phone call is usually best, particularly if it's time sensitive, so that, we can flag it for each other. What can constituents reasonably expect from our office? We're going to do the best we can for you, but again, as my cohorts talked about, you're dealing with independent agencies. We will get an answer. It may not be the answer we want, but we will get an answer. And again, reiterate that we can't alter answers or things of that nature. But we will get the answer from the agency and share it with you. And sometimes it needs clarification, as anybody that works on Social Security issues, if you've seen the letters, they're not terribly well written. So we can kind of try and help walk you through that. Or process of appealing Medicare, or, for instance, direct them to the Center for Medicare Advocacy when they're filing an appeal and need some help. We also will do, I think, to Karen's point too, that we will let people know if there's something dire need, that we consider it, again, food, water, utility shut off, roof over your head. We will make the agency aware of that situation. Again, whether or not they move faster on it is up to the agency, but we will make it clear what a person, paint a person's picture for them of the time sensitivity or the urgency of it. the limits of what we can provide too. No court issues or judiciary. However, I will say we can look up the case. I've looked up housing cases to just see exactly what's happening, to better understand the situation, or maybe give them resources that, like a lot of times the clerk's offices will have resources and things of that nature. Direct them to Greater Hartford Legal Aid or anything else like Connecticut Fair Housing. You direct them to the proper, I don't want to say authorities, but the proper folks that can help them even further, or reach out to those folks, get some information, share it with the constituent. How, if at all, do you relate to your colleagues? I'm loving having this conversation because then I get to see everyone, because usually we are on emails with each other or phone calls to each other. If a constituent, again, is repeating themselves in terms of inquiring to the senators and then our office, we will talk to each other, because all it does is duplicate efforts. It does not strengthen the case. It diminishes it to a certain extent. And if I have already run it by Social Security or whatever federal agency and gotten the answer from the agency, I'll at least share that with my colleague in the other office to say, look, this is what it is, unfortunately. A lot of times people try other offices because they're not satisfied with the answer from the agency. And practical tips, I echo the previous sentiments about having details, having a summary, having the release form is of the utmost importance, for especially if you're talking about anything to do with immigration or your passport. Wet ink signature, a pen handwritten signature, it is absolute. That because they use it for checking for fraud against other signatures in your file. Social Security and some of the other ones, we have a digital release form on our website that will suffice. And we're very, we'll be upfront, pretty realistic, as Karen said, about some things that we can and can't change. It's very difficult too. I think some cases can be fixed overnight, but we have immigration cases that have gone on for years. And so depending on the agency, that's going to depend on the kind of time frame, giving them due processing time and things of that nature. So, just want to let people know, we have pens, we don't have magic wands, but we do the best we can, because I think you're fortunate in Connecticut to have a bench as long and deep and wide as ours is in Congress. We're really the anomaly to the rest of the nation, and I'm very proud of it and the work that we do. Thank you so much.
Thank you very much, Lisa. Really appreciate that. And now we'll ask Kylie Dostey from Senator Chris Murphy's office to pull up her camera. And we'll say goodbye to Lisa for now. Hi, Kylie.
Hi, so I am Kylie Dostey. I do constituent services for Senator Chris Murphy, and I'm at the end, so I'm going to be repeating a lot of things. I apologize, but I see my role as an advocate for folks, and that I am truly here to try to act as the bridge between you and the agencies. And that is exactly what we do in this position. We handle everything from, like they were saying before, immigration issues, Social Security, Medicare, postal education, anything along those lines, anything to do with the federal agency. Specifically, my role, I handle Social Security, Medicare, along with other issues. And it's always best to just reach us through either calling or emailing us, whatever is easiest. I have my email up on screen, so you can always contact me through there if you have anything that you would like some assistance on. But I want to echo the fact that we cannot, from our position, make any sort of favorable decision when it comes to the agencies. We cannot dictate what they do. That is considered corruption. So don't want to do that. And we want to be able to just set that expectation that we're here act as your advocate, and we're obviously going to be contacting them and giving them all the paperwork that you've given us and make sure that they have everything that they need, but we cannot issue the decision on their behalf. And that is really the limit of what we're able to do. We are not able to issue any of the favorable decisions. I cannot give out legal advice. I can explain some of the letters to you. I can explain some of these processes, but I cannot really fill out the forms for you, But again, we can definitely help out with anything that you need in regards to understanding it and knowing what your next step should be. So, like Lisa said, we all talk to each other through email and we call each other and just let each other know exactly what is going on between the offices. People do oftentimes duplicate inquiries because they think it goes faster. It actually does not go any faster. It actually slows things down because it's just adding on to the backlog of inquiries that they're already dealing with. And my biggest tip is always just ask questions. There really aren't any stupid questions when it comes to understanding issues as complex as Social Security, Medicare. They are something that I'm still wrapping my head around on my third year in this role. I'm a lot younger than everyone else who's already spoke on the panel, but we all together share so much experience and so much knowledge, so never a stupid question to ask. So always just feel free through phone, email, whatever is best for you. And that is really my spiel. Since I was at the end, everything is feeling like it's getting repeated.
And that's just fine. And we sort of expected that. Thank you very much, Kylie. Now I'd love to open things up for questions. If we could pull our panelists back up. I know that Karen already answered one in the chat that Laura Cruz asked us about what kind of issues Medicare or Social Security issues they could handle. And she said for those that maybe didn't see it, they can address any issue with those agencies from overpayments and underpayments to Medicare terminations and late enrollments. No limits. We love that. Panelists, come on up. Don't be shy. Pull your cameras back up.
Yeah, put everyone's cameras up.
Thank you. We have a very general question and a good question. What will happen with representatives not meeting for 6 weeks? Summer vacation. Do you guys get summer vacation?
See a lot of no.
Those are very
No.
sad
Yeah,
head
everyone's
shakes.
shaking no.
Thank you, Jane, for that question. So in terms of these contacts, they're there.
Is that correct,
So-
everyone? Constituent services continue even when they're out of session. In fact, I imagine, and is this true, that when your bosses, as I know many of you call them, are in district, I imagine some of you are at least as busy, if not busier. I see some shaking hands. There's some heads. Anybody want to speak to that?
I don't mind taking lead because we were just talking about planning out we call it the district work period. We do not
Yes.
call it recess. I don't know why.
I know.
But it's a very great time because we're getting out into the district. We're going to senior centers. We're doing public facing events. We're meeting with constituents and, any opportunity for publicity, quite frankly, to draw attention to the matters that are of importance. All this while meantime maintaining the level of constituent services. Nothing changes in the office in terms of whether you reach us in August or you reach us in October.
Yeah, I certainly want to echo that. It is referred to as district work period, so we never get a break from it. I am in here every single day of the week, and I will be here every single day of the year besides holidays and weekends, and we will always be here to answer you and any of the questions that you have.
Thank you.
Love
I
that.
think it's also important to note that when the congressman is in the district and the meeting is on Social Security or Medicare, there's a very good chance we're going to be with our member. We're going to be, he's going to defer questions to us. Like they will say, oh, Karen's here, she'll help you with that, because they bring up their personal cases, and the congressmen understand the legislation and the law and what your entitlements are. But in terms of how to get it done, we're doing all of that. And so they're gonna refer people to us. I tease the congressman that I swear he writes my name on the bathroom wall, because the calls that come in afterwards are just so many sometimes.
Yes.
Thank you for all that. A couple questions about online presence for y'all. Beatrice asked, do your offices have FAQs regarding some of the more frequent questions you received? And if so, would they be available on websites?
I
couple
can speak from our office's perspective, from Senator Murphy's office. So we actually are the ones who write the blurbs on the website, is the caseworkers who do it, not the senator, not the digital team, is us who go in and write that. So we go in and we explain what we're able to do from our position. We leave our information there so that you can contact us. And again, if you ever feel like there's a stupid question, there really isn't. I've heard everything under the sun at this point, and it's a very confusing issue area, and we're always here to answer the question.
All right, thank you. And Celeste asks, do any of your offices have privacy release forms that can be signed online, like with a finger or mouse or stylus? Loving these answers today.
I'm seeing a lot of head shaking yes, for those who may or may not be able to see that. And Rebecca says yes.
I'm trying to say
thumbs
yes.
up. Yes. And Josh too, I believe. Everyone
Great.
else. Yes. The answer is yes.
In this day and age, that's fantastic.
Yes.
Um,
I think Lisa made one exception for immigration. That was it, Lisa? We needed a actual signature.
Yeah, that's the only one. The USCIS has a separate privacy release, and so does the Department of State, which does your passports, because they again are matching up ink signatures.
Good, thank you.
Question specifically for Senator Murphy's office. How can I leave an opinion for Senator Murphy? The website doesn't make this easy. Is there a direct email address?
I mean, hey, email me. You saw my email on the slides. Feel free. No matter what, it all goes to the same people depending on what the opinion is regarding. So we have our policy staff down in DC. They all have their own separate issue areas. And whatever you bring in, it doesn't matter which staffer you bring it to initially, it will always get to the right one at the end of the day.
Good detail to know. That's all. Oh, go ahead, Lisa. Sorry.
I just want to add really quickly too. I know people look for johnlarson.house.gov. I can tell you from experience, if we put each one of these members' names out there, it will crash the system. And that is exactly why we have the system set up the way we do, that you're not able to have that direct contact with the member of Congress, because we get spammed to the point that the system crashes. And we're also going to be able to have the bandwidth to answer you and get some more information for you, whatever the question may be or opinion may be.
Mm-hmm.
Excellent. Thank you very much for that clarification. That is all the written questions. Do we have anybody that wants to brave the live questions? I don't see any hands up.
Matt, I have one question for Kylie, if I can. When the senator walks across Connecticut in one direction or another, do you see an increase in questions, and do they differ on the geography he's covered in that particular summer?
So we actually just had our walk about 2 months ago, and he did it north to south on the western end of the state. And like Judy said, he changes up his route every year. We want to make sure that we are always hitting up different areas. So this year, actually, what he heard a lot about was around healthcare, but also a lot around housing this year. So it was very interesting to hear the different questions that people have and the different things that people are concerned with. But it has been, for the majority of folks, it has been around how.
Thank you. For Lisa, I've understood that there are increasing problems getting through to Social Security, and people worried about getting their checks, or if there's a problem, how they're going to are they going to resolve it. I know that that's a particular area of Congressman Larson's. If there's a real delay and people are not getting their checks or enrollment, or there's a mistake in the computer system, and maybe others can jump in as well. Is that at least a place where things could be sped up if you're calling rather than the individual?
Absolutely.
Okay.
Absolutely. If you have somebody that misses a check for some reason and they don't understand what's going on, Absolutely. If you have misinformation that you need clarified, because the current administration has put out a great deal of misleading information, which has made my job harder. But then again, I am glad to be the fact checker for
Yes.
people. And again, to your point, if there is some kind of emergency situation, let us know, because the people at Social Security care very, very, very much about the population that they serve.
Thank you. I see Karen particularly nodding her head yes. Did you want to add to that, Karen?
One of the best parts of representing the congressman is that we do have that direct access to those agencies.
Mm-hmm.
And in situations where, some people, their entire income, meaning being able to pay their rent or their groceries, is reliant on their Social Security check. And if they don't get it, or it wasn't deposited for some reason, because a lot of people have, it goes automatically to their bank, then they need to let us know, because we can, that is the one area that we can help navigate that situation quickly.
Thank you. Thank you. Rebecca or Josh, did you want to chime in about this or anything else?
I would just reiterate what they said, that if it is a dire situation, 100% reach out. We're dealing with real people at the other end of the phone or the email at Social Security, and they understand when something needs to be flagged and addressed immediately.
Thank you. Josh is according there. Thank you. Josh?
Yeah, I would just echo, basically what everyone said. If it's a dire emergency, there are ways we can get something expedited. Obviously, again, we do have our limits, but yeah, I mean, based on certain situations, yeah, we can certainly speed up the process.
Thank you so much. Thank you all. Matt, anything else?
Nothing we probably want to tackle here. We had one more question come in, but it's pretty darn big.
Okay.
And I don't know as we have the time with 3 minutes
Maybe you
left.
can get it to the right individual after the webinar.
It's a very big picture. About the future of Social Security and Medicaid.
Yeah.
So yeah, that is a conversation. That's a webinar on its own, frankly, right now. So I do want to thank everybody who participated today. Thank you all for taking the time, given how busy we know you are just from this. It's really appreciated. And we are recording this, and we'll get this out to our attendees, and we'll have it on our website. So hopefully it'll be a great resource for a lot of people. I also want to thank all of our other co-partners, make this project happen. And to tell you all to look for news on upcoming presentations in the weekly CMA alert. And if you aren't already getting our alerts, sign up today at medicareadvocacy.org. That's my little plug before we close.
Yes, and our website is listed there as well. Thank you, Matt.
Thank you all once again, and I will now conclude today's presentation.
Thank you all so much. Thank you.